So I'm not going to give you the history. Middle-aged patient, 56 years old. Sorry, so I'm going to let you look here. So this is a T2. Oh, wait, give me 5 minutes. Okay, so this is a T2. And you can see on the axial and on the coronal, there's multiple T2 hyperintense lesions throughout the pelvis mainly. You can see them on the coronal here. Many small ones, some that are a little bit bigger. I'm going to show you the diffusion, low B value, high B value. And this is a representative post-gadolinium. You can see that these do not enhance. And so patient is 56, incidental finding. Any thoughts? So multiple what appears to be cystic lesions, in this case throughout the abdomen and pelvis.
So we have a diagnosis of peritoneal hydatids, so a kind of caucus.
Awesome.
I guess you could always think about mucinous implants like pseudomyxoma spectrum.
Yeah. Perfect.
Any other guesses? Cystic schwannoma.
Okay, so something multiple cystic schwannomas, okay. Anyone else? All right, so this is something called benign multicystic peritoneal mesothelioma. This gross pathology pictures from this article from Radiographics from AARP. So basically what this is a subset of mesothelioma that we observe in the peritoneum. It is different from malignant peritoneal mesothelioma in that there's no association with asbestos exposure. It's basically mesothelial lined cysts, and they're thought to be different pathologically from peritoneal inclusion cysts, so they don't classify them in the same category. And these aren't chemoresponsive. Mostly they're treated surgically because they tend to recur. They have a high local recurrence rate, and people can get like obstruction as a result of that. So they're morbid in that sense, but this is not malignant and it's not associated with asbestos exposure. So very rare entity, and it basically looks like a bunch of clusters of grapes. No history of inflammation, nothing in these patients. So a rare thing.
That was awesome. That's really cool. So I didn't know that mesothelioma could be benign.
Yeah, benign cystic mesothelioma of the peritoneum.
Cool, very awesome. I recorded those, so